My name is Judanna. I've been utilizing the care of Mount Sinai for 3 years now. I've had different types of autoimmune disease, both diagnosed and undiagnosed, since I was 1 year old. It affected my life in many different ways. Not being able to go to family functions, not being able to exercise, not being able to eat the proper foods, having dangerous antibiotics that cause very dangerous things throughout the body were all part of my lifestyle. Illness, for me, was a constant battle. When Danny met me 25 years ago, he did not know what he was in for. Not only did I only have, to my knowledge, 2 autoimmune diseases, he had no idea, neither did I, that 7 more would be detected or acquired. He also saw me through thyroid cancer. I always thought it was amazing that after seeing me through all of this, my significant other, Danny, marries me after 12 and a half years. Your support system is the only way you can go forward. When I was going for my surgery at Mount Sinai for the sinuses, it was the day of the solstice, December 21st. I was the owner of a new puppy because I had lost my service dog. And my husband and I decided that it would be better for everyone around that he would be caring for the puppy in my absence and simply dropping me off at the door prior to surgery and picking me up at the same door. And he dropped me off. I said goodbye, kissed goodbye. He said good luck. Puppy was in the car, said, I'll be back. I went to the 2nd floor and I get to the desk and I said, oh, hi, nice to meet you, great, very friendly. It's early in the morning and these people had smiles on their faces, happy to meet me. And then I'm saying to them, I'm here for surgery today alone. And they said, oh, that's fine. Go sit on over there. We'll take care of you. And right away, my husband gets a message that I have now sat down to wait my turn. And he couldn't believe it. He was never more informed about my whereabouts better than this before. It made him feel extremely comfortable and he could just continue doing his responsibilities too. The next thing that happened is I'm called in to registration. And the gentleman who called me in was just so comfortable. It didn't seem like it was a job for him. It seemed like it was a pleasure. Oh, hi, nice to meet you. I'm so-and-so, and I'm going to register you here, so I have a couple questions to ask you, and just make yourself comfortable. And I already was comfortable, and now he's trying to make me more comfortable. It really makes a difference. When the preoperative staff realizes that one smile in the preoperative format could last an hour of calm. It's that human connection that can go miles, past even the surgery. You have the opportunity at that moment to be that surrogate family for that person. You might only have them in your grasp for 2 minutes, but in that 2 minutes, you can make a connection, you can smile, you can be peaceful. If you see something that you have in common with them, such as the same taste in shoes or jackets, or you really like their tattoo, say it, open up. That is doing your job in a way that reaches far beyond a job. What you have just done is dramatically reduce that person's blood pressure, respiration rate, and pulse. Now you're setting that person up for successful surgery. Now I'm preoperative. I've got the famous hospital gown on with the shower cap. The first dude who walks in is my anesthesiology doctor. So this individual walks in, totally approachable. Hi, Judanna. Nice to meet you. I'm your anesthesiology doctor. And I put some time aside because we're gonna need to talk. I said, oh, so you've read the protocol that I have to have for anesthesia? He says, yes, I was able to read through everything. So I have some questions so that we could be on the same side. And right away, I'm like, the one thing I would have had to have worried about is now not even an issue. I've already been built up by the team. And now I have an anesthesiologist who's done his homework, who knows exactly what we have to do, and is going to fine-tune the design of his art around my needs. So I'm feeling extremely safe, comfortable. It's almost like an invisible hug. It's like, you're in a safe place. You're in really good hands. So I say goodbye to him, and who walks in but Dr. Govindaraj? Happy, energetic, approaching me like we were going to get together to play tennis, rather that we were ready to have an operation. What could put me at better ease than that? The first thing he says to me is, all right, you ready? Everything's ready to go? Yeah, everything's ready to go. Okay, so who's your emergency contact? When has a surgeon ever asked me the name of an emergency contact that he could reach out to at any time? Nobody. He wished me well, and he said, I'll see you in the OR. And the next thing I know, I'm getting wheeled down by transport. And he's, hi, how are you doing? Nice to meet you. This guy was jovial, and he's addressing people that we passed in the hallway, saying hello to them by name. Everyone around me was pleased, thank you, excuse me. And it further made me feel that I was in good hands. And not any one of these times did I ever say, oh my goodness, I wish my husband was here. I need some support. The support surrounded me from the moment I walked in the door. I would definitely like Dr. Govindaraj's staff, as well as himself, to realize how much I appreciate the cohesiveness of their environment and how comfortable they make everyone feel. Whether you're with a preoperative patient for 30 seconds or 3 hours, know that you have an opportunity to extend to them the comfort that you would give a sister, a brother, a mother, a father, a spouse, and that for that short amount of time or that lengthy amount of time, you are the surrogate family for that person. I'd like to congratulate Mount Sinai for this opportunity, because this clearly shows patients that what they have to say matters, and it gives the patient the opportunity to leave a bit of their legacy behind. If you look at the complete construct of healthcare, the patient, the doctor, the janitorial setting, the secretarial staff is all working for the same outcome. And I believe you will have better outcomes if you continue this premise of really listening and sharing in the experience of all who you serve. I had a wonderful experience. I healed well, and I continue to go forward in that healing process very positively. And you set me up for that.